Having a persistent cough is irritating enough all on its own, but what happens when that ongoing cough is actually causing you to leak as well? I'm Lisa from Optimum Health, and that's what I want to talk to you about today, along with why it happens and what you can do to help prevent it. So what we have within our torso is essentially a pressure management system, and what we want to do is manage the pressure, particularly between our diaphragm, which sits underneath the rib cage, and the pelvic floor, which forms a basket through the bottom of our pelvis. Now, what can happen is when we're coughing, it also happens when we're sneezing or laughing. All those things are happening on a breath out when the pelvic floor should be gently rising. Now, what can happen is as we change our habits or get used to doing things a different way for any variety of reasons, rather than that pelvic floor gently rising, we're actually pushing down into it and out into the abdominal wall, which is then what creates that increase in pressure and the unwanted leakage. So if I show you with my clucky here, just coming in a little bit close. So when we do cough, what we should be able to do is support through the bottom so that we cough and the air comes out the top. When we're not able to manage that pressure, we're actually bearing down despite the breath out, causing that bulging down into the pelvic floor. Now, hopefully nothing is actually protruding. If it is, then please do seek medical assistance or the support of a female health physio. But what we can do is when we go to cough is just gently lift that pelvic floor to support the pressure management system within our torso, allowing us to cough without increasing that pressure downwards. So here what I'm talking about is thinking about your traditional pelvic floor exercises or Kegels. You may think of it as gently lifting the tailbone inside, forwards, up and through towards the front of the pelvis. Or the other analogy that I love is imagining that you are taking hold of an imaginary cherry with your vagina and drawing it up inside as you're breathing out. As you breathe in, you're then able to lower the cherry and let it go. And it's very important that it's a whole imaginary cherry at the end of that in-breath. So with that breath out, which is the same with a sneeze or a cough, if you're able to gently hold and lift that cherry slightly, you're going to prevent that pressure down into the pelvic floor that is creating the leakage. Now, it's really important that we get to sync the breath and the movement of the diaphragm with the pelvic floor to help prevent all such pelvic floor issues and to be able to integrate it into our movement and things that we do throughout every day as well. So it's important that you seek advice and support if you are experiencing this, rather than just hoping it will go away, because the sooner that we can treat these things, then the better the outcomes for everyone. And please do remember as well that if you have a persistent cough that goes on for more than 3 weeks, it is best to seek medical advice for that. If you'd like to know more though about how you can strengthen your core and floor to be able to enjoy all of the activities that you want without low back pain, pelvic pain or leakage of any kind, or if you're dealing with a prolapse or post-abdominal surgery, then please do get in touch. I would love to hear from you, and me and Clucky will do our best to help you. Thanks very much for watching, and I'll speak to you again soon. Bye for now.